Welcome to The Dental Brief, the podcast that delivers actionable insights and expert strategies to help dental professionals like you grow, lead, and succeed. I'm your host, Patrick Shavasty, the president of Omni Premier Marketing. Every week at The Dental Brief, we bring you real conversations from expert speakers that offer expert advice and quick tips that make a real difference in practices nationwide. Whether you're a general dentist or run a multi-location practice, we've got you covered with content that's designed to help you attract more patients, to streamline your operations, reduce headaches in managing your practice, and increase your profitability. If you're ready to elevate your practice, be sure to subscribe, hit the notifications bell, and let's dive into today's episode of The Dental Brief. Hello, everyone. Welcome to another episode of The Dental Brief. I'm excited to have a dentist on the program. Everybody knows how much I love it when dentists come on to share with other dentists. I think it's a great thing to do. Dr. Tyler Hales, say hello to everyone.
Hey, good morning. Thanks so much for having me on today.
Yeah, we're glad to have you here. I know you have quite the cosmetic business. I know a lot of dentists that want to get into that. We'll touch on that here in just a bit. First, I want you to tell me, how did you get involved in dentistry? What made you become a dentist?
Yeah, actually, originally I wanted to become a doctor. So my dad and my grandpa are both anesthesiologists. And that was really the path I was kind of going down, getting ready to go to medical school. And it really came down to, I realized that I wanted to figure out what I wanted to do for myself and not just follow the history of my family. And then that's really where I met a dentist who came and spoke to us at school. And I went and shadowed him and just realized, like, I love, one, working with my hands. I love being creative. And I love the business aspect of it. And a lot of times you don't get that in medicine. And in dentistry, you were able to really build these relationships and understand the story behind who these people are. And that's something that I love, is just figuring out what these stories are, being a storyteller, and it fit perfectly within this dental career and what I've loved. And I've never looked back, and, it's been something that I love and get to do every day now.
Yeah, so talk about your journey and you finished school. Tell us kind of how you got to start practicing and take it where you're at now.
Yeah, when I graduated dental school, I originally started working out of a couple different practices down in San Diego. I didn't want to go the corporate route, so I just really wanted to find my way through more just different type of practices. So I actually worked at a PPO office, I worked at an HMO office, and I worked at a Medi-Cal office. And this was right out of dental school. And the reason I did that was I really wanted to understand the insurance aspect of it and what I wanted to set up for the future. I think a lot of times in dental school or dental students, right, we told, okay, you got to get out there and do as much work as possible. But the dentistry is always the side that comes, I think, pretty easily. I think it's the business aspect that dentistry really fails at a lot. One, we're not really taught business at all. And two, it's not like dentists are super entrepreneurs. A lot of times, right, we get into dentistry because it's comfortable. A lot of times, our dad or someone in the family does it, and so we kind of follow their footsteps, but we don't know the business aspect of it. And so that was a really clear understanding for me on, like, hey, these are how the three different businesses work within dentistry, and help set up for me what I wanted to do when I ended up buying my own practice.
Yeah, great subject. So let's talk about those three different businesses inside of dentistry. What are they?
Yeah, I mean, there's a lot that you can go after. But initially, if you're looking at insurances, right, you got PPO, which is usually kind of the higher end insurances. You're going to get a better return for what you get procedure wise. So I'd say most dentists are now kind of in network, what we call about being with PPOs. HMO is going to be more of, you have a number of patients and you get paid for however many number of patients you have. And then certain procedures are covered under that fee while others are not. And that one's a little trickier because dentists have to kind of figure out, well, what treatments am I offering? And then usually those fees you're not getting paid enough to do those. And so they have to get creative in how they're going to get paid. And so it's a bit more interesting when you're running an HMO office, but it's very high volume. And then a Medi-Cal office, again, very high volume, very, very low fees. But that one actually was very rewarding for me because you're really helping a lot of people in need. And they're very grateful. They're there and they understand the situation. You're allowing them to come see you and you're making a big difference. And so that one I really enjoyed. Again, very high volume. I was able to do a lot of dentistry at that point, be able to learn really quickly. But it can be difficult because they also limit at what you can treat and what you can do and you've got to also can't always use the best supplies because your refund of what you're being paid for to do is not great. So
Sure.
great to kind of experience that. And they all are very rewarding. Honestly, I think any aspect you look into in the way you do dentistry can all be successful, but it's just about having the right game plan for what type of insurance you're doing.
And one size doesn't fit all, right? This is one of the things that, in my experience working with a lot of dentists over the years, is there's a lot of things that dentists think they need to do or that they should do because someone else told them that they should. Not that it's necessarily a good fit for them. Like owning a practice isn't the best fit for every single dentist, but yet a lot of dentists feel that they need to because that's just kind of what the status quo is or what peer pressure is or just kind of what everyone's doing. So they do the same thing that doesn't work out for them. You got heavily into aesthetic. And again, the website is halesaesthetic.com. Check it out. I mean, this seems to be your big focus. And I know a lot of dentists, we get the calls all the time, they want to get into TMJ or they want to get into sleep or they want to get into solely aesthetic. We actually, the first dental client that we ever worked with was only did cosmetic, did nothing else besides cosmetic, didn't have a hygienist in the building. That's all they did. How do you do it? How do you get to where you're at? What are the steps that someone can take to get to where you're at today?
Yeah, I mean, it's definitely been a long journey and I've loved the journey. I think that I'm still on that journey in what I want to create and what kind of impact I want to make in dentistry. And I think where it really started was with a passion of what I love to do. I started getting into cosmetics and I did a lot of general dentistry. I did a lot of sleep dentistry that I was really good at and was teaching. And the cosmetics was something that I kind of gravitated toward because it really allowed me to get creative in designing the smiles, but also showed the impact of when I talked to the patients and understood what their story was. I love kind of looking back and understanding where did these people come from? Where are their concerns? What are their limiting beliefs? And then how do I help them overcome those and create the next chapter for them in their lives? And I became almost obsessed with these like storytelling of my patients' stories and who they were able to become through these experiences. And it made an impact on me. And the more I kind of realized, hey, I want to be one of the best cosmetic dentists out there, I knew that I had to kind of let go of some other things. I had to stop doing implants, stop doing sleep dentistry, and really hone in on what I found I loved, but what I was really good at.
Yeah.
And so it's been this journey to this point where I am opening up my own practice in Corona Del Mar. We don't have a hygienist. We will be doing solely cosmetic dentistry. And I've teamed up with a ceramist to build out his lab right next to my office, where we've created what we call Harmony Veneers. And all of that has come one through learning, failure. You've got to fail to become better, but also having the right mentors to lead and guide you to the next steps.
Yeah. Would you say that a lack of focusing it on one thing, one area of dentistry, is what prevents a lot of dentists from actually making that happen?
Yeah, I think in my mind, when I was going through it, it was very risky, right? A lot of times when I talk to people or talk to mentors or coaches, right, they're like, well, I wouldn't do that because then what happens if there's a recession, right? What happens if people don't want cosmetics anymore? Like you don't have a fallback plan for your hygiene department, right? You don't have a fallback plan on just your general dentistry, right?
Sure.
I always say you need your bread and butter dentistry to pay the bills. And then that's, everything on top of it. And to some extent, that is the way that dentistry has been done in the past and it is still done today. And it's great. It works for a lot of people. But I think that if you really want to make an impact in this world, you can't do what everyone has done, right?
Sure.
You've got to figure out and really push yourself to become better. And that's what I feel like I'm trying to do. I'm trying to achieve things that really aren't being done and to do it differently, to do it better, to make it that dentistry can really be something that is impactful in the world. And a lot of times, it's kind of like you're just a dentist who really cares. But I truly believe that we can make an impact and it doesn't just have to be, through fillings and crowns.
Yep. There's that saying, if you want to go fast, go alone. If you want to go far, go with a team. Who are some team members that you've used and that could be, that employees, but who are some people that you've led on? You don't need to name names, but types of people that you've relied on that have helped you on this journey.
Yeah, I think finding the right mentors is important. One of my mentors was Dr. Brian Harris. He's an amazing cosmetic dentist that focuses on cosmetics, But he was one that really pushed me, right? He saw a potential in me that I didn't see in myself. And he kind of helped me get that vision and that fire behind, hey, dude, you can do whatever you want to do, right? Don't let anyone else and don't compare yourself to anyone else, but understand what your value is and how you can achieve it, right? And he was such an impact in me, and he still is today, of understanding who I am and then getting very clear on that definition of what I believe I am, right? And I think
Yep.
as dentists, we don't think about that. We try to compare to what other people are. We're worried about our neighbor taking the right patient, right? We need to have more of the mindset of abundance versus this competition. Because as we come together, we, like you said, a team is all us dentists coming together and understanding how to make this place better. And
Yep.
there's so many patients out there, we can all achieve greatness.
Yeah, I agree 100%. The abundance mindset is so important. It helps people go so far. Last question. What's a mistake that you've made that you're willing to share with others so that they don't make it themselves? What's one thing that you did that you're like, oh, if I had to do it all over again, I would have done that differently?
Yeah, I mean, I've made a ton of mistakes. And I think that that's why I am where I am today, is I've learned from those. One of the biggest mistakes I've made was I was doing a lot of dentistry and I was getting pretty good into cosmetics. And at the time, I didn't have an office manager. And it allowed me control. I like a lot of control. I like being in charge of the details, which makes me a great cosmetic dentist. But at the same time, I knew I needed to get someone on the team to kind of help run that aspect of it.
Sure.
And so I went and hired someone, but I didn't really do due diligence of like looking at the background checks or checking with other practices. I just had this vision and was so hopeful, right? This guy's going to come in here. He's going to allow me freedom to do my thing. And he's going to, manage this thing just exactly the way I wanted it, without really checks and balances and without actually doing a ton of training. And at the end, it was detrimental for my practice. He skyrocketed our overhead, and at the end, it really, we lost a lot of money, and it held us back probably about a year and a half from where I wanted to be. So a lot of times we think that, we can hire people and we don't have to do the training for those people,
Right.
because they'll learn on the job, or our team members will just train them. But we are the leader of the practice, right? We are in charge of sitting down and taking that time. And I truly believe if I would have taken that time, just, the first couple months, to sit down and make that time to train with them and help them understand my vision, the way I wanted to run this practice, instead of just handing it off and praying and hoping that it'll work, we would have had a different outcome and could have been farther ahead than we are now.
Yep. I think that's all really great. I would add to it, I'm sure you'd get there too, is just because one person did not work out in a position doesn't mean the next one won't, or the one after that won't. I see a lot of people do that. They hire someone to help them. It doesn't work out. And they're like, well, I tried that. It didn't work. I'm never doing it again. It's really not how we operate. It'd be like if, Edison and the light bulb, he's like, I did it. It didn't work. Forget light, right? It just doesn't work that way.
Yeah, no, I think, like I said, you got to learn from it. And so, I now have a great manager of my practice, and she, came from a position that was a front desk, and we've done the training, and she does amazing. Right. But I've spent that time. I mean, we meet pretty much every day talking about it. She knows exactly what I'm going to diagnose, the way I want to do it. And I trust her 100% completely now because of the time and effort we've put into it.
Yep. Dr. Hales, real quickly before we go, I just want to tell our audience, make sure you share this episode with somebody who needs it, who could benefit from that. It'll go a long way with someone. Dr. Hales, thanks for coming on. The website is haleaesthetic.com. How about coming back on again sometime soon?
Yeah, I love it. I mean, I love talking dentistry. I love helping other dentists, really figure out their brand and what they want to achieve. So yeah, I'd love to talk more.
Thanks for listening to this episode of The Dental Brief. If you found it helpful, give it a thumbs up, subscribe to the channel, and share it with a colleague who could benefit. We're here to help dental professionals like you stay ahead of the curve, one brief episode at a time. You can find more episodes and resources at thedentalbrief.com. You can also join the Growth Minded Dentist community on Facebook. Links are in the description. Until next time, keep learning, keep growing, and thanks for being part of the Dental Brief community.